today I'm delighted to join ANZUP in conversation and to be speaking with Ben Rogers, who is the Director of Health Professional Education and Training at Movember, based in Melbourne. So Ben, you gave us a great talk this morning around the work that you've been doing in the Men in Mind program. Can you tell us a little bit about that?
Yeah, thanks, Harry. And hi to everyone out there. So we know that men are dying a lot younger than they need to. So I just spoke a lot about, the statistics around this. And we know that a lot of men are accessing healthcare in the lead up to taking their own lives. And so I kind of unpacked that and spoke about some of the influences on that. But also tried to introduce some research that's sitting behind it and the Men in Mind program, which we're rolling out across the country at the moment.
And so what is Men in Mind?
Men in Mind is an evidence-based training program that supports health professionals in learning the skills to best engage and respond to men when they step through the door to their service or their program.
Fantastic. And so you said it's evidence-based, and where does that evidence come from?
Yeah, so over a number of years, we've been rolling out the training. So we started off with a pilot study to show its feasibility and then moved into a randomized control trial that was rolled out. And what we found is that both the pre and post measures, we used a scale called the Engaging Men in Therapy scale to track pre and post measures. And it showed really significant increase in confidence, particularly in responding to men experiencing suicidality and depression. Men who, where practitioners might have challenges in engaging and helping them to unpack and express their emotions, and also kind of holding that space for anger as well. So we're noticing, and we saw a lot of changes in confidence in that space. Alongside that, what we've seen is improvements that have sustained over time, both at the 3-month mark, and we've recently had a 12-month follow-up in that as well. So,
Okay.
yeah,
Great. So that's the impact on men. No, sorry, on practitioners. How about the impacts on men when they're working with therapists who've been through the program?
So yeah, we're kind of in the early stages of firstly rolling out this program across Australia. So one of the things that we're wanting to test over time is the impact that it's having directly on men. I think first and foremost, we need to get it into the hands of as many practitioners as we can across the country. We're also funded by the federal government to roll this training out for primary healthcare professionals because there's a really significant need, not just in the mental health space and in the primary care space as well.
Okay. And so if you're a health professional watching this, how do you get involved in Men in Mind?
Yeah, so the first step is to jump on the website, Men in Mind, and you can work through and understand what the research is and sign up through that process. As I mentioned, we're funded through the federal government to roll it out to primary care. And so that rollout process will be in collaboration with a lot of organisations and PHNs across Australia.
Fantastic. So thank you so much for talking with us this afternoon, Ben, and everyone get online and check out Men in Mind. Thanks.
Thank you.